Welcome, everyone. If you didn't meet me, the first section of the conference, my name is Karen Henshaw, and I am the Associate Program Director for the Connections and Health team. And I believe I will do introductions, and I think we have slides that have people's images and titles. Okay, see, there's me. We also have Alia Amin. She is the Cardiovascular and Diabetes Coalition of Indiana Coalition Lead. She's part of the Connections and Health team. And then I will start introducing the Purdue Extension staff that are going to be presenting today. We have Lori Bouslog. She is from Vermillion County. Sherry Brown is from Blackford County. Danielle Scott is from Madison County, and she moved from Grant County to Madison County. So when she's talking today about county engagement, she's actually talking about her experience in Grant County. Then we also have two community wellness coordinators from Purdue Extension with us. We have Allison Finzel, and she represents Vermillion and Vigo counties with her work. And today is talking about her experience with Vermillion County and the county engagement process. And then also Lindsay Cox, who works in Blackford and Delaware counties and has been working with us in Blackford County with the county engagement process. So I think now I'm going to pass it over to Lori Bouslog to talk about what does an extension educator do.
Good morning, and we are so happy to have all of you join us today. So I wanted to share just a little bit about what exactly a Purdue Extension educator does. We in Purdue Extension provide education to people of all ages in every one of Indiana's 92 counties. The community is actually our classroom. We actually bring the information from the university, the research-based information, to the residents of each of the counties in Indiana. Specifically in health and human sciences, we have 4 specialty areas, and each of the health and human sciences educators assigned in Indiana have a specialty area. We focus in the areas of food, family, money, and health. So you can see on the screen that we provide programming in the areas of foods and nutrition, human development, financial resource management, and health and wellness.
All right, and I'm going to tell you about community wellness coordinators. So community wellness coordinators are part of the nutrition education program through Purdue Extension. Purdue's College of Health and Human Sciences houses the nutrition ed program, and NEP is funded by a federal grant, SNAP Ed, so that's Supplemental Nutrition Assistance Program, and then there's FNEP, the Expanded Food and Nutrition Ed program. So CWCs, we work with partners on community change through policy, system, and environmental projects. Our coworkers are nutrition education program advisors within our department, and they get to do that direct ed. So they'll teach classes like Eat Smart, Move More, teen cuisine. So the nutrition ed program's 5 focus areas are related to food, nutrition, and physical activity. And our priority audiences are folks who qualify for SNAP or FNEP, people and communities with limited resources, schools with 50% or more free and reduced lunch. So now we'll talk about in Blackford County. So in East Central Indiana, we are really lucky to have an existing health coalition through our local IU health hospital system. So there's a hospital in Delaware County, Blackford, and Jay. And that coalition is called the Healthy Community Alliance. And its focus areas are on eating better, moving more, and not using tobacco. So Extension was already a really active partner in the HCA, and we've been able to utilize that existing network. And Connections and Health team members have also been able to join in the HCA meetings. So I think, like a lot of us have experienced with this pandemic, we've shifted to virtual. So the HCA shifted to hosting guest speakers or educational sessions, and maybe trying to engage partners that had not been as active recently. So letting those folks be a guest speaker at a meeting. And we have found that attendance has changed. So some people we have not seen for a while Broadband internet access is limited to non-existent in our rural counties. But we have started seeing other people who are able to tune in virtually when maybe they could not ever make it to an in-person meeting before. So for instance, our Delaware County Food Council was a spinoff from the Delaware County Nutrition Work Group of that HCA. So it has now become a regional food council, and it has absorbed the nutrition work group. And Blackford and Jay counties are more active in that food council, whereas before they weren't there. We have found that the magical networking and the connections that happen in person are still happening virtually. So leading better virtual meetings, the HHS educator in Jay County, she and I both attended that workshop through Purdue Extension Community Development. It was really valuable. So we were able to share some of our takeaways with the two community engagement folks from IU Health, and then implement some of those tools into the HCA meetings. And with our connections in health and our CADI work within Blackford County, we've been able to use both in-person and hybrid meeting formats. And a lot of that has shifted to using multiple formats. So, okay, we have a survey, but we have an electronic version and a paper version. We have press releases in the local paper and online at the Positively Blackford website, Facebook, paper flyers, phone calls, in-person chats, all that stuff that I think a lot of us are having to utilize to really get the word out. Sherry, do you have anything you would like to add before we advance to the next slide?
I think I'm just going to talk in a few minutes about how we made that shift and some of the challenges and the benefits in Blackford County. So I think we're good, Lindsay. Thanks.
Alrighty, so like Karen mentioned earlier, I'm Danielle Scott, and although I am the Health and Human Sciences educator in Madison County, I was previously in Grant County, so that's what I will be speaking on today. And I'm sure you'll start to see some trends through the different counties, so Blackford and Vermillion, as well as Grant, on how we've adapted to life in a pandemic, working in a pandemic, and keeping up with our projects and connecting with each other. So I'll just share a little bit here. One of the health coalitions in Grant County was formerly Torch, is now renamed to Breathe Easy Grant County. As I'm sure most of you have noticed in your communities as well, there was that initial shift to virtual. So that's what we adapted to. We wanted to stay connected, so we went to virtual. We got really familiar with Zoom, as I'm sure all of you have as well. And so as it became safer for us to do so, we would meet hybrid, so some in person, some virtually, just to ensure the safety of coalition members, but still, again, wanting to remain active through the community. Also, Breathe Easy Grant County, because schools was something that a lot of us could not get into for the safety of the staff and students in those schools, as well as ourselves. Breathe Easy Grant County, the coalition in Grant County, created a virtual classroom so that they could continue work inside the schools as the schools were going virtual, or excuse me, we're not letting as many guests in, so that they were still providing that education, that sharing awareness to those students throughout Grant County. And additionally, on top of that, keeping that online presence. So maybe not so much, we knew we were doing the work in the coalition, but we wanted to remain in the front of people's minds in the community to say, we're still here, we're still working for our community. So keeping that online presence via social media, just to stay connected through that as well.
Okay, so in Vermillion County, I've been working in Vermillion County about 3.5 years. And when I arrived here, there was no active health coalition. And, you know, timing can be everything. It's so critical. The community has to be ready for coalitions and relationships to be built. So I think it was 2019, I attended the Connections in Health, the very first Connections in Health conference, and learned that Vermillion County was likely going to be working with Connections in Health very closely to help improve the health outcomes. So we tried to find an opportunity to introduce the Connections in Health team to stakeholders, and resources in Vermillion County. So we hosted a lunch meeting, as luck would have it, in early March of 2020, right before the pandemic. Just about a week and a half before the pandemic sent us all home. That was our opportunity to bring agencies and organizations together to begin that networking process and start that conversation. During our time together over lunch, we conducted a SWOT analysis, we shared local health statistics, and then things paused for a bit, about a month. And then through that time, with additional conversations, we realized that probably for our situation, it would be best for us to partner with Parke County, a neighboring county, because Parke and Vermillion County residents tend to use the same healthcare systems. There is no hospital in Parke County. Those residents come to Vermillion County to the hospital. So we decided joining together as a group would be a great thing. We decided that rather than wait for the pandemic to end, we would move forward. And I'm really glad that we did. I'm glad that we made that decision. We have been meeting monthly via Zoom. And through those meetings, we have gone through the process of identifying the coalition's mission, vision, and goals. And we've provided amazing opportunities for the folks who come to those meetings to network. We are averaging anywhere from 20 to 30 attendees at each monthly meeting. So I'm going to pass things to Allison for her to continue sharing.
Yes, good morning. So once we all mastered Zoom, we continued, like Lori said, continued to meet, and we worked on making some working groups. So we decided that food insecurity and was something that we really wanted to work on. We wanted to develop a resource manual that would list all the different agencies that we were working with that were coming to these meetings and what they had to offer, and then connecting healthcare. It's been a wonderful place for people to get together, share information. Each time that we meet, we've had guest speakers, and they've talked on a variety of things. Catholic Charities has talked on, on their mobile pantries that they have, but it's just bringing Parke and Vermillion together. I've been working in this county for, probably about 2 years. And Vermillion is a very long county. There's a north end and the south end. It's very rural. So to get those two people to talk, this has been a wonderful opportunity. Zoom has been, I think, beneficial because people come that usually, because the county was so long, because Parke County's in people can join in the conversation that might not have been able to take an hour out of their day to get to a meeting in person. So with our coalition, I think Zoom, it's been a somewhat of a benefit. But it's just been a great place to meet people. I've met a ton of people that I would not have known if this coalition hadn't started.
So you might be wondering, what is county engagement? What does that look like? What does that mean? And so I want to just take a few minutes to share with you what that looks like for us. So what we do is we build a team with local stakeholders. We usually start with our Purdue Extension partners because we know their boots on the ground and they know what's happening and who the best resources are in the community. So we work with that team and we build a list of important people that we should listen to. We do listening sessions. A listening session is just an hour where we have some questions that we ask the community member and get to know their community, what their interests are, what they see as successes and challenges, and where they would like to see growth or what they hope to achieve in the future in their community, especially related to chronic disease areas that the Connections in Health coalitions are working to address. We also are joining local coalitions and community groups. We are helping to provide resources and connections and support. We have lots of experts on our statewide coalitions and connections to folks on the IUPUI campus and at the Indiana Clinical Translational Sciences Institute. And so we're trying to connect people in the community with the people that are the experts on campus and the other campuses across the state of Indiana. We're also collaborating to address challenges that are identified by the community. So as we listen to community members during the listening sessions, we're taking note of what their desires are, what they think are some major challenges or roadblocks to their community being as healthy as they can be, and helping to connect them with the resources and experts in order to possibly seek funding and start some projects or work with existing groups in order to address those challenges. So that's a little bit of what county engagement looks like. And so now I'm going to turn it over to Sherry so that she can talk about what happened with Blackford County.
Thank you, Karen. So with Blackford County, and Lindsay, who works with me, she's our community wellness coordinator, does an amazing job of the overview, and she knows who everyone is and where they fit. And I'm a much bigger picture person. So when Karen called me, and I knew Karen from her previous job here with Extension, so we had worked together before, and when she called me and said, we've got this opportunity. Well, just like everyone else on this call, we were in the middle of deciding and regrouping and figuring out what we do, how long will this last, all of the questions we all ask. And she offered this opportunity and said, we'd like to come to Blackford County. We have resources, we have partnerships, we have all of these wonderful things. And it sounded really fantastic. So I was excited about it. I had recently changed from an HHS focus to HHS and community development. So I was looking for that sweet spot between the two. What can we do to move the needle on health and address community needs? And there's plenty of room there for work. So Karen and I spoke, and it sounded really exciting. And it was probably a couple months later when I really got involved, because they were working with the other counties, kind of wrapping up there, and then we're going to start Blackford County's effort. So when I attended my first Zoom with the team, they were well engaged in what they were doing. There was a lot of new lingo. You know how that goes anytime you work with a new organization, plenty of new acronyms, lots of new things happening. And it kind of made my head spin. I thought, what have I gotten into? Because there was just so much new information, so much at once. It was the fire hose. So as we began to work through what we were going to do, we began to do the surveys and the listening groups. Everything started to take shape, and the county was introduced into amazing new resources, networking opportunities, new people to reach out to. Initially, Karen had said, she'd mentioned resources, and a lot of people mention resources, and resources come in a variety of forms, but we were blessed that resources came in the form of financial resources for a project that focused on combating chronic health issues. So when we brought our group together in May for a town hall, local residents decided that we wanted to focus on making the healthy choice the easy choice, because people were making easy choices when it comes to nutrition and things like that. We really wanted to focus on nutrition and how we can infuse better nutrition into people's lives through just exposing them to healthy foods that also taste good. So we began to work on that. We developed the Passport to Wellness that you see there on the screen. It has little tips, just very simple tips on things that people can do to begin their wellness journey or further their wellness journey. And Taylor University is a partner with us. So they bring resources. Their students are at local events conducting health screenings. We've also served and will continue to serve healthy snacks at local events, just to introduce people to the idea of healthy choice, easy choice. And we'll continue to build to grand finale, if you will. It'll be, we're still working on the details, but it will be in a community-wide event that will celebrate healthy eating, healthy living, and then we're going to move that right into enhancing the value of public spaces program, which will allow us to take a better look at what we're doing with our public spaces and help people get more active. So right now we're focusing on the nutrition and easier or more availability or exposing people to healthier choices. And then we'll move the needle again when we look at the larger picture with our parks and recreation. I'm going to pass on now to Danielle.
Thanks, Sherry. So again, talking about Grant County and that partnership with Connections in Health, as you can see here on the slide, I underlined and bolded connections because that was one of the biggest benefits. When Karen got into contact with me, I was a fairly new educator, so was not from the area of Grant County. If you're in extension, you know how it can be when you're new. So you're figuring out a lot of things. And this was a huge benefit to me as well as the community, because I was not only gaining those connections, but I was also helping build this initiative with Connections in Health. So it was a good partnership, connected with existing agencies in the county and throughout the state, and created a space to build relationships, network, brainstorm, and I'm sure you'll hear from all of us. We are so thankful for that partnership because it has benefited us professionally, the community. Connections in Health has also been amazing at sharing out our programming as well. So it's just been overall a good partnership. Like Karen mentioned, there was the listening session. So that happened in Grant County. And as you'll find out from each of our counties, we all had a different idea or action to address, because like, every county is different. The needs are different throughout the state. So what came out of Grant County was the lack of community collaboration and communication. So with that idea ready to be addressed, we had a focus group in Grant County, and we're working on, when it was safe to do so, hold a networking event in the community to help spread awareness through organizations, agencies, and the community of what exists in our county. How can we partner? How can we work together to address the bigger needs and health? And so working together and trying to combat the lack of community collaboration and communication. So that's why I put the puzzle pieces on here, is because we know they're there. It's just a matter of connecting them. And again, Connections in Health was super beneficial in helping pile that together and piece it all together. So I will pass that on to Allison and Lori.
Well, I have to say exactly the same thing. Connections in Health has been an outstanding partner for me personally. I live in Vigo County. I work, my office is here, but, and I've traveled to Vermillion County for 25 years to get my hair cut, but I didn't know Vermillion County until Connections in Health kind of came around, and we started doing or working with them, and the benefits and the people that I've met. But we started our Connections in Health process with listening sessions. And so Lori and I set out to do listening sessions. I think Lori called people that she knew, and we set up these sessions, and I think we did over 70 of them. So I have met I probably know more people in Vermillion than I do in Vigo now. But we listened, we had questions, we talked with them, got to know how they felt about the community. We had discussions, input, all kinds of things. And then when we had all that done, the things that kind of bubbled up after everything was done was the community was concerned and wanted to work on poverty and food insecurity. So through those contacts and through the Connections in Health people, we are now working to to engage the community, hopefully bring both ends of the community or the county together to work on these two issues and all of the different, the people in connections in health they fit right into the spokes, and it's been wonderful.
So as has already been echoed, just the opportunity to provide, to network and to meet new people. When I landed in Vermillion County 3.5 years ago, I had a lot of extension experience, several years, 3 decades plus of work in extension with Purdue Extension specifically. And I also had ties to Vermillion County. I grew up in the county just west of Vermillion County, across the state line. I have many relatives who actually live in Vermillion County, but it didn't take me long to realize that I still had a lot to learn about the county that I was working in. And so, just to echo what Allison said about those listening sessions, as someone relatively new to the county, it was just an amazing opportunity to meet people, build relationships, and have conversations about what's important to the residents of the county. And so when we look at the CADI resources that have been available to Vermillion County, we have had opportunities to support a brand new community garden in the north end of the county. There was nothing of that sort in the north end of the county. We've also had an opportunity to provide support to a high school greenhouse in the southern end of the county. And it was there, but it needed some funding to provide some updates, some renovations, so that it would be a functional space for high school teachers to actually provide some hands-on learning to the students enrolled in those classes. And then, of course, educational programming that is in part support or provided by Purdue Extension, by our nutrition education program advisor, Judy, who also, like Allison, is housed in Vigo County, but provides educational programming for Vermillion County. And you can see the two images on this screen. These are both from the new community garden, the Eugene Station Community Garden. They had a ribbon cutting in early May, and Purdue Extension in Vermillion County was very happy to support that with educational information and resources to the community and the folks who were interested in having space in this community garden. And then you can see also the different plants that have been grown in the county. So we also have spent a lot of time kind of drilling down into the issue of poverty and having conversations about how we look at how that's going to be addressed in Vermillion County. So through the process of asset identification, we've had conversations about how we can leverage those assets that each one of us bring to the table so that we can have a greater impact in the county. So we're looking at specifically poverty. We know that food insecurity is part of that greater picture, but we are looking at how we can address poverty in Vermillion County.
Hi, so just a quick overview of CADI community funding, and some of these ladies have already touched on that. So this is like a subset of the county engagement we have $20,000 from the state to implement an evidence-based community-led project. And as they kind of talked about the process, we had a town hall with community members, providers, to really get a good idea of what is going on in the community, where they want to focus their energy. And I think the real takeaway here is that this project is meant to build momentum for further change and prevention. Our goal is not to come in and put on a Band-Aid and we know it's not going to solve everything, but it is at least a way to build that momentum that's going on in the community. So we've been really fortunate that we're able to do this, and we were able to do the community garden, which has been fabulous. We had the mobile kitchen in Grant County, which is going to be amazing as well. And then in Blackford, with the making the healthy choice the easy choice, is the CADI initiative there. So it's been a lot of fun and really incredible and inspiring to see all the connections and to really give people a chance to shine in their communities and really take the lead and ownership of what they want to accomplish. So with that, I'll turn it over to the next person.
Yeah, so in Blackford County, like, Alia had said, we did these town halls. So we decided evening was best. We did one for community members in person, one geared toward healthcare professionals virtually. And then those were both in May. And then in June, we had one where we brought everybody together to really talk about, okay, what did we learn from the first two? And that top image is what we learned. So that's our summary of our strengths, our areas for improvement. And we had these meetings facilitated by Strategy by Stone and Mindflower Studio. So Mindflower Studio is the storyteller. And so she drew that amazing image for us. So we've partnered with community volunteers, including the county health department. We have that partnership with Taylor University, which is located next door in Grant County, and specifically a few professors, one in particular, Eric Hayes, who has been just incredible to work with. And he is co-director of this center in downtown Hartford City in Blackford County called the Invitation Program. So it is all about lifestyle medicine. So, eating better, moving more, sleep, better sleep habits, stress management, those sorts of things. So they have been really key players in this. They've helped with the passports and the recipes and having med students available to do these health screenings at the existing events that we're showing up at. So those are things like soccer tournaments, concerts, festivals, events that were already happening that we're just showing up at, trying to meet the people where they are. And we're using some incentive prizes, hey, if you do, 5 of these health screenings throughout the season, here's, a blender or something. And like Sherry said, we're working towards some sort of a fun wrap up sort of event. And so one nice thing about this is that there's been flexibility. Plans did not work out how we initially dreamed, and it is taking longer to really get the word out, to get that community buy-in, to get the community really engaged and know who we are and what we're doing. So we have that flexibility to move our wrap up date later rather than try to force it too soon and it flop. So keep building that momentum. And thanks to our connections with the Hoosier Health and Wellness Alliance, specifically that Parks Board Working Group, that's where we'll have funding from the State Department of Health to implement enhancing the value of public spaces, creating healthy communities. And again, that flexibility where, our Parks Board in Hartford City is really, they're regrouping right now. So it's maybe not best just to kick off as soon as what we had intended. So it's really wonderful that we've had that flexibility to do things that are more impactful and not force it to fit. And so our goal with the EVPS will be that we hope to create a Parks and Rec strategic plan and get it through that approval process in 2023 through the Indiana Department of Natural Resources. And, I think what has been said is that a lot of this work is really, there were so many wonderful things already going on, especially related to health and community. So we're just trying to wrap it all under one umbrella, and Connections in Health has really helped us do that. You know, we're really able to start planting those seeds for that greater community change, which takes years to accomplish. And it's really amazing to have the support and the resources and the technical assistance from Connections in Health.
Alrighty, so Grant County, just a little disclaimer, because I am no longer in Grant County. There may have been a few things that have progressed since I left, but with that CADI community funding, there was a focus group of statewide and local entities. And of course, we were addressing that cardiovascular disease and diabetes. So what came of that in Grant County was plans for a community-wide mobile kitchen that would be housed at the local hospital, Marion General Hospital, and partner across county agencies to provide food safety and nutrition education to community members. So finding that curriculum so that it could be different entities checking out or renting, I guess, the mobile kitchen and having an accurate curriculum to provide to their participants. So yes, I will keep it brief. If you have any questions, because I know we're running out of time, please put those in the chat. I'll be happy to answer them. But yes, so that is a little bit about our community-wide mobile kitchen.
Okay, so in Vermillion County, when we looked specifically at efforts working with CADI, our focus group included local and statewide resources. We used a variety of tools. You know, CADI had a lot of different connections on the statewide level, and we were able to use those resources to gather input from community members. And Allison is going to share just a bit.
So yeah, like I said, food insecurity was identified as one of the primary challenges, and we were able to partner with Catholic Charities and do a few big food distributions that happened during the pandemic. But we held one at the fairgrounds in Vermillion County and had over 800 people come through. We had one in Perrysville. And had over 250 people come through and get these boxes, and there's pictures of the boxes, the CFAP boxes that they received. The one neat thing that's kind of bubbled up in the last week is we had met with the ministerial association in Vermillion County and had been talking to them about putting together a food pantry coalition, and we met with them this week, and we are going to, they're all in. So we are going to move forward with a food pantry coalition that's much needed. And I've already had one of the sites call me because he needs funding for a refrigerator and freezer. And he's hoping that with all of us working together that we can get some grant funding and that kind of thing. So it's really neat. Hopefully, you know, we all come together and get this going. So
I'm not going to spend much time on that last bullet from that previous slide, but I did want to share just real quickly that as of this morning, that little brand new community garden at Eugene Station has harvested 1,170 pounds of produce this summer. And I think that speaks volumes for what can be done with some really dedicated volunteers and some community support.
Thank you, everyone, for sharing about your experiences and your successes. I just wanted to take a real quick moment to talk about what's next. We are still talking with folks in Blackford County. We are hoping to start talking with community members in Washington County in October and this fall. And if you are one of those folks from Washington County or you know people there, please reach out to us. We would love to have a conversation with you. We then have the other 6 counties that are red on the map: Clay, Jennings, Lake, Madison, Marion, and Stark. And we're in the conversations right now of determining which county we will engage with next. That likely will announce this fall, and then we will start talking with folks in that community early 2022. So I hope that you have learned a few things about what Connections in Health is doing as far as county engagement. I want to thank all of our presenters. I do see some information some questions in the chat box. If they're directly related to this presentation, we are happy to answer those. I know there's a question from Janet about the cost of the kitchen, and we can email that information to you, Janet, so that you have all that info. And I'm going to send you now onto a break. If you have specific questions for Purdue Extension, I would encourage you to reach out to them. Their contact information is on the screen right now, and feel free to ask them if you have questions for any of the folks from Purdue Extension. The conference will resume at 11:10. You have about 9 minutes to return to the main Zoom, take a break, fill up your water bottle, stretch a little bit, and be ready for the next presentation in about 9 minutes back at the main Zoom. And I just posted that link in the chat box again. So we will see you there. Thank you.